Welcome to the Biology of Meaning mini-series, Video 13. Today we address the question, how do you know if a prescribed treatment is harmful? We explore the concept of iatrogenesis. Because from the perspective of biology of meaning, BMS, the symptom is not the problem, but rather the biological solution. But what happens if the treatment you receive disrupts the body's adaptive sense? Modern medicine has saved millions of lives. But there is also a little discussed reality, iatrogenesis, that is, the harm caused by medical interventions that have become normalized, yet are ethically unacceptable. From the perspective of biology of meaning, the body is never wrong. Every biological process responds to an adaptive program. 1. Reframing illness. The German physician Reich Gerd-Hamer proposed in his explanatory model that every symptom has an associated biological conflict. The goal is not to destroy the symptom, but to understand its function. The philosopher Michel Foucault already warned that modern medicine not only cures but also produces realities, diagnoses, and categories that shape how we understand the body. When we treat a symptom without understanding its meaning, we run the risk of suppressing adaptive processes, perpetuating conflicts, and generating new symptoms. 2. Warning signs of possible iatrogenic harm. From an integrative pharaoh perspective, a treatment may be harmful when the symptom progressively worsens after starting it, new symptoms appear that did not exist before, overall vitality decreases, or the person becomes disconnected from their bodily awareness. Researcher Enrique Corbera emphasizes, the body is not the enemy, it is the messenger. Silencing the messenger does not resolve the message. 3. Conscious clinical criterion. The biology of meaning does not propose abandoning treatments. It proposes making the intervention and its risks conscious. Key questions for evaluation. What biological function does this symptom serve? Am I treating the cause or the effect? Is my body improving overall, or is only one sign disappearing? Have new symptoms or signs appeared since I started the treatment? True medicine is not about suppression. It's about integration. And a treatment should cure, not perpetuate an illness. If it doesn't cure, it's because the treatment is incorrect. If other symptoms and signs appear, the treatment is incorrect. 4. AQL analysis. From Ken Wilber's comprehensive model, every therapeutic intervention should be evaluated in the 4 AQL quadrants. 1. Inner individual, consciousness, how the patient experiences the treatment. 2. Outer individual, biology, physiological, and side effects. 3. Inner collective, culture, medical beliefs, and clinical authority. 4. Outer collective, system, protocols, consultation times, industry. When only the biological external quadrant, symptom drug, is considered, the medical act is reduced to a mere technique. Truly comprehensive clinical practice requires also evaluating subjective experience, relational context, and institutional structure. Ignoring one of these quadrants leads to partial interventions, and every partial intervention increases the risk of epistemological iatrogenesis, treating data and forgetting people. 5. Your right to your treatment. It is true that many people feel they do not receive enough information about side effects or do not have the opportunity to calmly decide on a treatment, usually pharmacological. This is often due to systemic factors that must be corrected, such as limited consultation time of no more than 10 to 15 minutes, an excessive workload that calls for a review of the healthcare system, and the relationship between expenditures and effective health solutions, institutional protocols that often lack compassion, and a lack of critical thinking on the part of healthcare professionals who simply follow orders for convenience and with disinterest in the quality of life of patients. There is no justification for continuing to support deficient healthcare services paid for with public funds. International ethical standards promote informed consent and shared decision-making, where the patient has the right to ask questions, understand, and accept or refuse treatment. But beyond this, the reality is that current treatments do not aim for a cure. In holistic, conscious medicine, the patient is neither obedient nor rebellious. They are an active participant in the therapeutic process at all stages, including the financial aspect. Today, a patient cannot consciously decide on their treatment because they are presented with only one alternative covered by health insurance, an ineffective and expensive proposal because it does not cure and in many cases aggravates the condition. That is the reality of MO, Western medicine, or MOB, biological Western medicine. Pharaoh key learning. The correct treatment is not the one that eliminates symptoms the fastest. It is the one that respects the organism's biological intelligence. Pharaoh phrases. The body is never wrong. The mistake is not listening to it. Healing is not silencing. It is understanding. A suppressed symptom can become a chronic conflict. True clinical practice begins when the patient understands their process. The medicine of the future will be integrative, or it will not exist. Pharaoh integrative therapy, conscious clinical approach. Complementary interventions that can accompany medical treatment. Body dimension, acupuncture and traditional Chinese medicine, TCM, regulate the biological terrain. Herbal medicine supports function without suppressing processes. Therapeutic Qigong restores vital flow. Psycho-emotional dimension, inquiry into active biological conflict. Archetypal symbolic work, Jungian approach. Reframing symptom perception. Consciousness dimension, observational meditation on the symptom. Coherent breathing. Conscious somatic awareness. Objective, for the patient to stop fighting against their body and begin collaborating with it. To achieve this, the environment must also collaborate by respecting natural cycles. This is conscious intelligence. A Taoist inspirational quote to conclude. When the remedy respects the flow of the Tao, it heals. When it forces it, it disturbs. True medicine does not impose, it listens. Subscribe to the channel, like, and share to raise collective awareness. Learn science with awareness because in health, knowledge is not neutral, it is vital. Study with ECEL Pharaoh.